HarperCollins presents That One Patient, Doctors and Nurses' Stories of the Patients Who Changed Their Lives Forever, by Ellen de Visser. Read by Julian Wadham, Karen Cass, and Andrew Byron.
Foreword. My brother-in-law's funeral was held on a sunny afternoon in February, a day when he would ordinarily have jumped straight onto his 10-speed. Somewhere in that crowded room was a grieving oncologist. He'd taken the afternoon off, he told me, to come and bid farewell to a patient who had become his friend and from whom he had learned a great deal. His comment intrigued me. Patients obviously learned from their doctors, since they are constantly explaining the origins of illnesses and what can be done about them. But the other way around? Were there perhaps other doctors roaming about, preoccupied with the memory of a particular patient, or with a story they will never forget? That idea formed the inspiration for a series of columns published in the Dutch newspaper the Volkskrant in the summer of 2017. Doctors talking about patients who had left a special mark on their lives and taught them valuable lessons. Conceived as a filler series, the kind often used by papers to get through the quieter summer months, we initially only planned to publish 6 columns. Finding 6 doctors who were willing to come out and tell their personal stories would prove difficult enough. Or so we thought. The opposite proved true. Doctors were eager to participate, and most interviewees knew exactly which patient they would talk about straight away. Our short-term experiment blossomed into a regular weekly column, and after some time, doctors even took the initiative and began approaching us themselves. Very soon we cast the net wider to include not only doctors, but also nurses, psychologists, even a midwife and a medical social worker. I rarely knew what to expect before each interview. I remember a greyish Monday morning in April when a forensic pathologist drew me a sketch of the sun rising slowly above a field of wheat next to a bank by the road, where she had just confirmed the death of a young motorcyclist. Shortly afterwards I was back outside, dazed and slightly shell-shocked, solitary amid the hustle and bustle of the Amsterdam traffic, as though nothing had happened. Doctors and nurses need a unique form of professional empathy. At the same time as caring about their patients, they must keep their own feelings at bay as a barrier to shield them from the crushing emotional weight of their work. But there are patients who break through that barrier, who manage to touch and move their doctors in some way or other, ultimately shaping their thoughts and actions. And that is what healthcare professionals wish to share. Stories confessing a certain vulnerability, one that continued to astound me week after week. In the medical world, emotions have long ceased to be a sign of weakness. In her book titled What Doctors Feel, American doctor Danielle Offrey explains how the quality of healthcare is highly impacted by doctors' emotions. Health professionals learn not only by practicing the medical and technical aspects of their jobs, but also through their human experiences. In the words of one doctor, "We have such intense contact with patients during a unique and often highly emotional period in their lives, it gives us food for thought whether we like it or not." To our Dutch readers, it was as though these aloof, distant creatures in their white coats became more approachable with each passing week. They wrote in to say how moved they were by the doctor's openness, by the significance of the lessons they described, and how they started looking forward to each new column. A poet once submitted an original piece for a psychiatrist. An old lady expressed her support for a young doctor in training who had made an error of judgment. A man admitted to bawling over his breakfast one Saturday morning after reading an oncologist's story. A few days after clinical ethicist Erwin Compagna told of a young woman who had died in his hospital over 20 years earlier, I was contacted by the man who had been the patient's boyfriend at the time. He sent me a photograph of Irma, putting a face to the patient I had written about. I was granted a few more behind-the-scenes glimpses like this. While lying in a hospice during his final days, the patient of gastrointestinal specialist Joost Drent read
Sample complete. Ready to continue?